Monotherapy is no longer enough for the treatment of type 2 diabetes mellitus, according to NICE 2026 guideline. Metformin has been set quite back in for the treatment of type 2 diabetes mellitus. Previously, we used to start metformin as a single monotherapy and titrate the dose of the metformin according to the HbA1c level and fasting and postprandial blood glucose levels. And if the patient have the other comorbidities or the risk of the cardiovascular disease or the renal disease, we used to add some drugs, for example, like glimepiride, that is sulfonylureas. But now the NICE guideline says that even if the patient is without any comorbidities, irrespective of their HbA1c levels, we should add drugs like SGLT2 inhibitors or GLP-1 analogs with the metformin as a combination therapy. This guideline also says that if there is a contraindication for the metformin, for example, if the GFR is low or if there is a non-tolerable patient for the metformin, so we can stop the metformin and start SGLT2 inhibitors like dapagliflozin or empagliflozin as a monotherapy from the first day itself. And for the obese patient, we can add GLP-1 analogs. For example, oral semaglutide. There is only semaglutide which is present in an oral form as a GLP-1 analogs, and rest of them are available as the subcutaneous injections. And also we can add tirzepatide, which is GLP-1 analog and GIP analog both. Because the GLP-1 analog and GIP receptor analogs are the best drugs for the patient who are obese, who have the centripetal obesity, because these drugs control not only the blood glucose level, but also it helps in the weight reduction of the patient. And as a result, with the weight reduction and the better glucose control, the patient can have the great outcomes and a good prognosis and the prevention of the acute coronary syndrome and the cardiovascular diseases and renal diseases. So, as a conclusion, today's the treatment of diabetes is not only about controlling a blood glucose level, but yes, to protect the heart and kidneys for the acute any acute incidences or going into atherosclerotic coronary artery syndrome or the chronic kidney disease or the kidney failure. So share this video with your friends or the person who has been known case for the type 2 diabetes mellitus, so that he can be benefited. And you should start the early treatment, because diabetes is a disease which is diagnosed already when the diabetes has been destroyed our body up to 20 to 30%. So early detection and early prevention and early treatment can give a good outcome and a good prognosis in the patient with the diabetes mellitus, so that we can prevent the cardiac events and the kidney failure and the kidney symptoms. Thank you. Stay healthy. Goodbye.